So Ebola this year, has gone into an urban area, which is the first time it's done that. So it's caused a bit more concern. And not only is it going into urban area, but it's gone into a river port that connects with CAR and with Brazzaville, Congo-Brazzaville. And so I'd say one of the biggest concerns for this year's Ebola is that, one, to contain it in this urban area, and two, to try to track it well. So if it gets out of the area that's being controlled, which could happen just in a day with the boat going up or down the river, that is identified and actions taken to control it in those areas, which has added a new dimension to the Ebola crisis this year. There's been 9 incidents of Ebola outbreaks in Congo over the years. And for 3 of those, IMA has been very involved in addressing it with the Ministry of Health. This year, the role that we are playing is to help them monitor the spread of Ebola. So we have our health information team actually working with the ministry in Kinshasa, and starting this week we're moving into the Ebola area with our team, and we will have a information center trying to track every case and get it onto the map and help the government know where it's spreading and where it's been covered and all the different aspects of tracking it from information's perspective. Support's needed now because often the areas that are being covered by the government are just where the cases are. And like I said earlier, it can jump very quickly to another area. And this area of Congo is actually one of our member agency areas as far as having hospitals and clinics, and they probably haven't received any equipment or any training as to how to deal with this, but it could jump in on them very easily within days if it happens to go that way. Historically and currently in this outbreak, what IMA's done is to try to work with either member agencies or with our project partners to prepare them for any case of Ebola. So we have gotten protection kits several times over the years and distributed them to these hospitals. We've worked with the government to do training so that every 2 years or so people are informed as to how to protect themselves, what to do for taking samples, what to do in the community to keep it from spreading, because it can get into that community and it might be several days or a week before the government comes in.